Good afternoon, my dear students. Today we are going to see a new topic. Chapter's name is Chapter 13. Chapter is Why Do We Fall Ill? So, first of all, before learning this chapter, we should know what is the healthy condition and what is a condition of disease. So you know that our body is made up of cells, right? Cells, different types of cells unite together to form tissues. So each cell contains carbohydrate is the, protein is the, fats are the, lipids are the, and so many other functions are the, right? So if any, usually a pattern will be there, right? If any change, anywhere it is happening, it will leads to disease condition. That is a condition. Okay, so we cannot say any part, maybe some the usual pattern. If any imbalance coming in the usual pattern, we can say the condition is known as a disease. Okay, so cells move from place to place. Sometimes some cells will move from place to place. Some cells will be stationary. So they some cells need repairment, right? The maintenance they need. Some cells will die, new cells will come. So that all is happening in our body. So our body have different organs which have different functions, like heart for beating, for pumping the blood. The lungs are breathing to get air to different parts of our body. The kidney is filtrating urine, and the brain which control everything. So these all activities are interconnected. For example, if the kidneys are not filtering urine, the poisonous substance will be accumulated in our body, right? So under these conditions, the brain will not be able to think properly. So all this activity, if you're taking one activity, digestion, if you're taking digestion, all brain also involved in that. So many other organs are involved in that. So all are interconnected. Okay. So if any cell is feeling irritated, our whole body will be imbalanced. So anything that prevents the proper functioning of the cell and tissues will lead to the lack of proper activity of the body. So that condition we will say disease. So for the condition being healthy, our all cells should be proper. Otherwise, if any one is imbalanced, we will say that condition is known as diseased condition. Okay. So now in this slide, we will see what is health and its failure. So health is a state of physical, mental and social well-being. Three things we have to keep in mind, not only physically, that physically also we should be healthy, mentally and socially. Conditions necessary for good health are good physical and social environment, good economic conditions, social equality and harmony. So you can see different conditions. So some people will tell our health in different ways. So the three, if you are taking health physically, mentally and socially, we should be fit. So good physical and social environment includes clean surroundings, good sanitation, proper garbage disposal and clean drinking water. So this thing, physical and social environment, if our surroundings are not clean, we can get disease, right? If our house is clean and our neighborhood house is not clean, the chances are the mosquitoes will come, housefly will come, so we can get disease, right? Then good sanitation, proper sanitation home, proper garbage disposal. The waste is accumulating in our house, we should dispose it properly. And clean drinking water. If these things we are not taking care, this can lead to disease condition. Okay, so this is very important. Good physical and social environment. Second one, good economic condition includes job opportunities for all for learning to have nutritious food and to lead a healthy life. So if our economic means our that money in our hands. If it is not there, we cannot able to buy nutritive food, right? So that will leads to malnutrition, that can lead to an disease condition. So we should have good economic conditions. Then third one is social equality and harmony are necessary for healthy and peaceful life. If we are fighting with our neighbors or any other problems is there with the society, we cannot live a healthy life. So these are the three important things we should keep in mind to be happy and to be get a healthy and peaceful life. So in this slide you can see, as I already said, the three things. Physically we should be fit, socially we should be fit, and mentally also we should be fit. So these three things we have to keep in mind. If you are physically fit, socially and mentally if you are not feeling fit, we will not feel happy. So these three things for a good healthy life, these three things we should keep in mind, and these three things should be fit. Okay. Now we will see what is personal health and community health. You know that personally we are maintaining our health, right? Nowadays COVID is spreading, so nowadays everywhere we are getting different types of awareness to keep ourselves in, right? So that is personal health and then community health. So these two also you have to keep in mind. Then only we can stay healthy. If we personally you are healthy, but if you're going out, they are not the community. The community, so many things are there. Unhealthy practices are there. We will not get a good, healthy life. So first of all, personal health means, as I already said, three levels: physically, mentally, and socially. We should be fit. Okay. Then only the individual maintains his or her health. That means if I want to be healthy, I should maintain my surroundings clean, right? My house where I am living, that we should keep clean. That is the personal health. Then an individual can maintain his health by eating balanced diet with a food which contain all the nutrients like carbohydrates, proteins, fats in equal proportion. That is the balanced diet. We should be careful. Then observing personal and domestic hygiene. Hygiene, I think you know that hygiene means yourself and your surrounding, means your house and your surroundings should be hygienic. Then consuming clean food, clean water and clean air. Then proper exercise, relaxation and good habit. That also is very important. So this is the personal health. So you are living in a home. If we are not going outside also, sometimes we can get disease. Every time nowadays we are sitting at home. So I think you are not getting that much disease because we are sitting in our home. So we are not getting any contact with other peoples which have infection, right? If you are going to school and all, maybe 1 month, one time you will get cold and cough, normal cold and cough, right? So nowadays we are sitting, from March onwards we are sitting in our home. So I think you are not getting that much diseases, right? So when we are going out, we should think about our community also. That is community health. So we will see what is community health. It is the maintenance, protection, and improvement of health of all, not only ours, community as a whole. Then community, the whole community remains that should be healthy. Community health can be achieved by provision for treated and safe drinking water. That water is very important because if we are drinking that unhealthy water, means unclean water, it can lead to so many microorganisms will be there in the water. It can lead to different types of diseases like cholera, dysentery and all. Then next one, proper disposal of sewage and waste. you can see we will clean our house, but sometimes no, we will take this all waste and wrap and we will throw outside, right? That time we will not think about our community. That we should think before doing that, right? So then providing medical facilities, control of communicable diseases and health education. So these are the points we should keep in mind for both personal health and community health. So you can see it is a great deal of garbage thrown in our street, right? Or if there is an open drain, water lying stagnant around where we live, this leads to the poor health, right? Therefore, public cleanliness is important for individual health. So we need to be happy in order to be truly healthy. Or if we mistreat each other and we are afraid of each other, we cannot be happy or healthy. So all things we should keep in mind. Okay, social equality and harmony are therefore necessary for individual health. So we can think of many other such examples of connections between community issues and individual health. I hope you understood this topic. Now we are going to the healthy and disease free. So healthy means it is a state of physical, mental and social well-being. Three sides should be healthy. Okay. Then it refers to the individual physical and social environment. The individual has a good health. So that we will call as healthy. Then disease free means it is a state of absence from the disease. It refers only to the individual. The individual may have good health or poor health, okay, but disease free. The condition is known as disease free. Now we will see what is disease and its causes. So disease is any condition that may lead to discomfort, distress, health problems or death of the affected person. So there is a difference between healthy and disease-free state of a human body. Disease can be classified into acute and chronic disease based on their durations and complications. Disease can also be classified into infectious and non-infectious based on their structure of virus or different criteria. Causes for disease can be classified into immediate and contributory causes. So, the disease and the causes. First of all, if a disease coming, we have to see the symptoms, right? If you have any headache and all, if you're going and seeing the doctor will ask what all are the symptoms, right? That first we have to see the symptom, then only we can recognize what is that disease. So there are different types of causes are there to get a disease. So first of all, if we are going to see a doctor, he will first see the symptoms and he will try to find it out by some test. So then only he can find it out what is the disease. Depending on the complexity of the disease and the duration which it is taking, the disease is divided into acute disease and chronic disease. Acute means it will once it is starting, it will take only short period. Like cough and cold will be there. No, that will take only maximum 1 week or 2 weeks. That is known as the acute disease. But some other disease which will last a lifetime, a long time it will take, that is known as the chronic disease. Okay, so the disease lasts for only very few period of time is known as acute disease, and the disease which lasts for long time, even a lifetime, that is known as the chronic disease. So as an example, about a cough and cold, a person which who having cough and cold, which all of us have any time, right? Most of us get better and become well within a week and so, and there is no bad side effects on our health. We do not lose weight, we do not become short of breath, we did not feel tired all the time because of the few days of cough and cold. But if we get infected with chronic disease such as tuberculosis of the lungs, then being ill over the years does make us lose weight and we will feel tired. So we may not able to go to school for few days if we have acute disease. But in the case of chronic disease, maybe that person have to go to hospital. They cannot follow that in a regular way. So the chronic disease therefore have very drastic long-term effect on the patient's health as compared to the acute disease. So now you can see in this slide the diseases are divided to acute and chronic. So acute diseases are the disease which lasts only for short period of time. Example, common cold. And it cause major effect on general health in a very short time. Major effect, maybe few days we will feel tiredness. That will not last for long time. Feeling tiredness does not occur all the time. After the disease gone, that tiredness will go. The weight loss does not occur and one does not become short of breath. Acute disease do not have long-term effect. It will maybe 1 week or 2 week. After that period, tiredness will go. It will not last for lifelong. That is the type of disease known as the acute diseases. Next is chronic disease which lasts for lifetime. Example is elephantiasis. Any other diseases are there. It takes a long time to cause major effect on general health. In case of chronic disease, one feels tired all the time. Weight loss occurs and one becomes short of breath. Chronic disease have long-term effect. So this is the difference between acute disease and chronic diseases. Now again diseases are divided to infectious disease and non-infectious disease. Infectious disease are the disease which are caused by some pathogens, maybe viruses, bacteria or some protozoan, the agent like air, water or other vectors. That type of disease are known as the infectious disease. Maybe we can get disease from one person to another person. That type of disease is known as the infectious diseases. Okay. Non-infectious disease means that is non-transmitted from one person to another or not to any virus or bacteria. Okay, that is produced in our body by itself. Maybe some changes is happening and it is maybe due to the lack of something or some changes is happening in our body, or it is transmitted from generation to generation. That type of disease is known as the non-infectious. It is not caused by any pathogens. Okay. So now we will see what are the difference between infectious and non-infectious disease. Infectious disease is caused by pathogens, while non-infectious disease are caused other than pathogens. So many other cases are there. So infectious disease is caused by extrinsic factors, means the factors which is coming from outside like viruses, bacteria, protozoan, etc. And it is transmitted from one person to other with the help of some medium like air, water or some animals. While the community hygiene can reduce the occurrence of this disease. So infectious disease can be reduced if we are keeping ourselves within. So you can see what of infectious disease. I will say one example. Now we are not going to school or anywhere else, right? So we are sitting in our home. You can recognize that this type of like common cold, cough is not coming to you that much regularly. Otherwise, maybe 1 or 2 months, one time you will get this cold and cough. That are infectious disease, means it is transmitting from one person who is sitting nearby you to next person. So easily it can transmit. Okay. So that type of disease is known as the infectious disease. Now I will show you some of the infectious agent which cause infectious disease. One, now you can see one picture. That is a picture of SARS, SARS, severe acute respiratory syndrome, which can cause diseases. Like from this family only COVID-19 came. Next picture you can see. Now you can see another picture of the infectious agent. The name is Staphylococcus, bacteria which can cause acne. Acne means the pimples which we see in our face while in a teenage time you can see some pimples that is caused by this infectious agent Staphylococcus. The scale of the image is indicated by the line at top left, which is 5 micrometer long. Now in this slide you can see the picture of trypanosoma, the protozoan organism responsible for the sleeping sickness. Now you can see the picture of leishmania, the protozoan organism that causes Kala azar. The disease known as the Kala azar. The organism is oval shaped in structure and it have a one long whip-like structure. Common examples of disease caused by viruses are common cold, influenza, dengue fever and AIDS. Diseases like typhoid, fever, cholera, tuberculosis and anthrax are caused by bacteria. Many common skin infections are caused by different kinds of fungi. Protozoan microbes cause many familiar diseases like malaria and Kala-Azar. The viruses, bacteria and fungi multiply very quickly, while worms multiply very slowly in comparison. This means that many important life processes are similar in the bacteria but are not shared with virus group. As a result, the drugs that block one of these life processes in one member of the group is likely to be effective against many other members of the group. The same drug will not work against a microbe belonging to a different group. As an example, we will discuss about antibiotics. Maybe you are familiar with antibiotics. They commonly block biochemical pathways important for bacteria. Many bacteria, for example, make a cell wall to protect themselves. Antibiotic penicillin blocks the bacterial process that builds the cell wall. As the result, the growing bacteria become unable to make cell walls and die easily. Human cells do not make a cell wall anyway, so penicillin cannot have such effect on us. Penicillin will have this effect on any bacteria that use such process for making cell walls. Similarly, many antibiotics work against many species of bacteria rather than simply working against one. But in the case of virus do not use this pathway at all. That is the reason why antibiotics do not work against viral infections. So we have to, for example, if in the case of common cold, taking antibiotics does not reduce the severity or the duration of disease. However, if we also get a bacterial infection along with the viral cold, taking antibiotics will help. Then even then the antibiotic will work only against the bacterial part of the infection, not the viral part. This you have to keep in mind. When we are taking antibiotics, it will affect only the bacteria. It will not cause any harm to the virus. Okay. So now in this slide you can see, can you tell what is it? That is the coronavirus, COVID-19. So that is a virus. So now also scientists are searching the vaccine for coronavirus, right? Because that virus will every time it will change its shape. After reaching the host only they can change its shape. That's why that effective medicine we cannot find it out. Then antibiotics, we cannot give antibiotics to kill the virus also. So that is why the scientists are still struggling to find out this vaccine for coronavirus. So coronavirus is an infectious disease. So one thing we can do now to keep distance from each other. That is why doctors are telling to keep distance, so that that our like anything from one infected person will not be contacted to next person. Okay,